26. So, Denise, how can providers be prepared and really practice good billing and good coding when it comes to these products? I think we want to get people not scared, but prepared, right?
Absolutely. Yeah. And it's, again, another situation where the sky isn't falling, and we're looking at this big pendulum swinging of, we've been charging this, we're probably not going to end up here on the reimbursement, but it'll maybe settle somewhere in the middle. But just making sure we're doing our due diligence in our billing and coding. So are we getting the right etiology for our wound? Down to the basics of wound assessment. Do I have the right etiology? Have I managed those comorbidities? Does the etiology match the LCD for what would be paid for a skin substitute
but
or a
don't
CTP?
make it
But
match.
don't change. So I actually had clinicians say, well, if it's reimbursed at that, I'll just change the ICD-10. No, that's not the right way to do that. So as you do that wound assessment, what is it? Is it a pressure injury? Is it a diabetic foot? Is it a venous? And knowing that some of these products can only be billed for certain kinds of wounds. So kind of understanding that to start with. And then managing comorbidities, as we look at, and are those comorbidities also coded well? And making sure that we have medical necessity in our documentation. Just have we explained the reason that we want to use these type products?
Yeah, I think that's really important. It all starts with that etiology and choosing what is this wound? It's funny, we're doing a retrospective study. We're data mining from EMRs, and we find diabetic foot ulcers on the buttocks. I don't know.
That's not a thing. I say that's a diabetic with a wound, not a diabetic wound.
Right,
Exactly.
right. So picking the right code, it really goes back to that etiology, and does it make sense?
And being specific, that's another one. If you can be very specific, it's a diabetic wound and it's on the toe. And maybe it has an arterial disease as a supplement comorbidity, rather than maybe a diabetic wound elsewhere not classified. The more specific you can be with that ICD-10 code, the more you're clarifying the type of wound that you have.
And I think those unspecific codes are sort of red flags.
They are. They're kind of a trash can code. And so you want to steer away from those.
Yeah, it kind of shows that you might not know what you're doing.
Exactly.
And that you don't need any kind of, welcome wagon for auditors or,
don't shine the limelight if you don't want the limelight on that part. Exactly.
Yeah.